So, according to an article about feminist ethics and menopause, autonomy and decision making by Dr. Margaret Martov, quote, in a study of general practitioners' accounts of menopause and treatment in Australia, women's choice, informed decision making, and empowerment were key themes through which primary medical care for women at menopause was presented. The main points here being choice, informed decision making, and empowerment. So women have a choice to their own bodies and what they're doing to them. They have the right to be informed on what decisions they are making, and they can be empowered through those decisions.
All right, so I'm going to be addressing choice by the woman. It is important because in specifically polydactyly, there are 6 genes that have been identified for polydactyly, as well as correlation with family history. So between these 2 findings, I think it's important that women are given the option to prevent future costly and time-consuming issues from future generations. And then because of female and parental choice in general, the surgery, it's important that right now they currently have the option to have surgery or not have surgery. And that's because polydactyly is a continuous process that may lead to multiple surgeries, possibility for physical therapy, and all of these factors, parents have to decide if the surgery is a viable option for them or not. So why would we not continue with parental choice and germline gene editing? So foot polydactyly causes both functional and cosmetic problems for the patient. Functional problems relate to the shoe fitting difficulties if the patient does not have surgery, and pain for walking, while the cosmetic issues pose more of a concern in cultural tendencies to like being barefoot in public, for example. Polydactyly of the hand often appears on the dominant hand, and according to case studies provided by Harry D. Wessel, these impairments hurt the dominant hand usefulness, and even with surgery, most live their entire lives with a decreased range of motion in their hand. Now I'm going to be talking about informed decision making. It's important currently for polydactyly patients for their parents to be informed on the timing of the surgery, because if the patient receives the surgery at an advanced age, further surgery is often required to reconstruct the ligaments, bones, or fusions of the joint. If the patient receives the surgery prematurely, the thumb or toe may be too small to remove without damage to the epiphyses, which causes a closure and shortening of the thumb or foot or toe. So even with surgery, a finger or toe may never look cosmetically the same, and ultimately parents should be warned of this, and it requires maximum transparency on the physician's side. So in regards to germline gene editing, other genetic abnormalities might also be linked with the genetic mutations caused by polydactyly. Polydactyly can occur by itself, typically as a manifestation of autosomal dominant mutations or in conjugation with a syndrome of congenital abnormalities. In this article, specifically by Kapoor and Wessel, a specific case study, one patient had polydactyly of the right thumb, cleft palate, and congenital hearing loss and blindness. There's also 19 specific case studies that they looked at that had both polydactyly of the hand and the foot.
So moving on to empowerment. Decision-making of women has been an issue for a very, very long time. According to an article by Wendell and a whole bunch of other doctors, quote, traditional practices of care in which care was solely a, quote, women's practice, end quote, have undermined the personal autonomy of women themselves. Women have not been able to make decisions, not just on germline gene editing, but menopause and abortion and other issues throughout the course, and I think that germline gene editing is just an extension of that.
30 seconds.
And by not allowing women to be empowered by this decision and not allowing them to make the best decision for themselves, we are therefore decreasing the autonomy of women. And that is the end of our opening statement. On to you guys.
So we would like to argue that polydactyly can provide patients with an augmented ability, and germline gene editing is unnecessary for this condition because there are more cost-effective options such as a vascular clip and surgery available.
All right, so in discussing dexterity specifically, according to a publication in Nature, researchers C. et al. Discuss how 6 fingers allows for more complex manipulation, meaning that having a highly mobile thumb allows individuals with polydactyly large versatility and dexterity, which in turn yields higher sensory motor ability overall compared to normal-bodied individuals. This could mean like enhanced ability in like basic things with your hands, like using utensils, like shoes, video games, playing an instrument, anything to do with your hands. And also when discussing surgery, an article from Healthline discusses how if polydactyly is not associated with other genetic syndromes, the extra digit can usually be removed with routine surgery, which is most cases. The child's doctor can usually continue to monitor if the hand or foot is functioning correctly or not. And the surgery is possible for adults to improve the appearance or functionality of the hand or foot additionally.
So more along the lines of surgery, as mentioned before, the 2 most common types are vascular clip and then full removal of the extra digit or splitting of a fused digit. All of these surgeries are very routine and usually, if done before the age of 2 or 3, when most bones in the hand have fused together, it can be removed quite easily and the bones can be placed back, the remaining bones can be placed back together and easily healed with a cast in an outpatient procedure. Many doctors, however, are moving away from vascular clipping just because it leaves nerve ends, which can lead to further surgery. But regular surgical removal of an extra digit or division of fused digits usually does not require extra surgery. Can be done for either cosmetic or functional purposes.
So the average cost for surgery for polydactyly is $4,122. And then when compared to the large cost for germline gene editing and other gene therapy costs, this is a fairly inexpensive amount. And according to an article by Most Chose, the average cost for gene therapy and germline gene editing is $500,000 to $1.5 million. And when this is compared to the $4,000, it's pretty expensive when compared to that. And for germline gene editing, the drugs that the patients have to take after can cost $750,000 for 1 year and then $375,000 for years after that. And patients can also incur 50% tax credit for research and development of germline gene editing in addition to their treatment costs, which were close to $1 million. And patients may also additionally incur costs for the orphan drugs that were associated with germline gene editing. And we would like to conclude our argument that polydactyly can provide dexterity advantages, and germline gene editing is not a very cost-effective option because vascular clip and surgery is available.
Dexterity was increased when surgery was partaken in to deal with polydactyly. However, in the results of surgery for polydactyly of the thumb, a review from the Clinical Orthopedics and Related Research at the United States National Library of Medicine, there are case studies that describe the difficulty picking up fine objects. Tip precision in scripts can be impaired, which shows that at times there are, while it may be able to be more dexterous, there's also the adverse effect that can occur and is likely to occur where it impairs their mobility with their hands or foot. And also, how important is it to single-handedly tie shoelaces or play a complicated video game if the person, because of the polydactyly, knowing how other minorities or genetic conditions have been cast out in society before, they would be cast out for being different. So how would that make a big bit of a difference? If polydactyly is not associated with other genetic syndromes, the extra digit can usually be recovered with removed with routine surgery. This is important to note because polydactyly is always occurring. So even after the first surgery, the cost would keep rising because of the amount of surgeries that may occur from this. It can be utilized to improve the appearance or functionality of the hand and the foot, but would you be able to guarantee that the patient would have the same appearance or functionality as a person without polydactyly? Nothing is absolute when it comes to this, so there is always a possibility that the surgery will only harm them rather than to actually improve their daily lives and make it seem more like an appearance. And even with like the expensive cost, it's not like much of a difference. And according to Harry Wessel, in his case study of patient 9, the patient had polydactyly of the right thumb, cleft palpate, congenital hearing loss, and blindness. There are patients that could have both polydactyly of both hands and feet who are observed to have both. Thank you.
So one of the topics your group touched upon was decision-making and empowerment and choice by women. But we're trying to say that when the person can do surgery in a vascular clip, they have the consent and the HIPAA guidelines that the providers will follow, and this will definitely provide either the parent or, if the person is old enough, the choice to do the surgery, and the choice will not be restricted. And so you also stated for future costly and time-consuming issues, you stated that germline editing would lead the person to avoid such issues, but the truth is that people would have to keep taking drugs that would cost them $750,000 per year, and if they do surgery instead, they could possibly avoid this cost with the cost of occupational therapy and the surgery, which would be about $4,000. And for the decreased range of motion, the patient can do the vascular clip or the surgery to get rid of the finger, and this could help with the issue of the range of motion. Thank you.
So when you're in our closing statement to conclude, when you're talking about the autonomy of women to have the surgery and HIPAA guidelines and all of that, that's still not taking into account having the choice to germline gene edit. You still have this choice. Yes, we're not saying that everyone should germline gene edit their child if they're going to have polydactyly. What we are saying is it is the autonomy of choice. Are you going to be able to germline gene edit or not? There are two decisions, and it's up to women to make that decision for their own child. Also, vascular clips and other types of surgery, we cannot give a blanket statement that there is one way that we should treat this disease. It should be a choice between many other different types of options so that you have these different options for people to choose with their informed decisions. To conclude with a quote by
All right, for our closing statement, like we agree that women should have autonomy, have a choice in what they say, but these surgeries have been performed for decades and are really reliable, they're routine, they're more cost effective to germline gene editing overall, and they have a really high success rate, 81%. And even in cases where polydactyly, the children are born with it, in cases where there's no serious health conditions, there's several advantages to anybody that has polydactyly, if it's not a serious health condition.
Okay.